Good afternoon. My name is Mario Merialdi. I'm coordinating the team for improving maternal and perinatal health at WHO in Geneva. First of all, let me thank the organizer for giving me this opportunity to share with you today some consideration about the importance of integrating maternal and child health and genetics. I would like to start by giving you a brief overview of how WHO works. The World Health Organization is actually the agency of the United Nations which is in charge for global health. It is based with its headquarters in Geneva, Switzerland, and it is usually perceived as an agency which issues statistics, guidelines, and recommendations. However, there is more to this. WHO should be an organization able to understand and to respond to what are the needs of individual organizations, countries all over the world. We can actually do it through a network of 6 major regional offices and 147 country offices. These network of offices represent, if you want, our finger on the pulse, which allows us to understand what are the health needs at country, regional, and global level, and to act effectively, collaborating directly with countries. In this global context, maternal and child health is acquiring more and more importance. Why? Because if we are looking at a single striking example of health disparities between rich and poor countries, we find it very easily by looking at the statistic of maternal and newborn mortality. Every year we record more than 350,000 deaths of mother dying for complication of pregnancy and childbirth, and more than 4 million newborns are dying for the same condition. 99% of these deaths occur in the poorest countries of the world and could be prevented. Therefore, the problem of mothers and infants dying in large number in poor countries, it's a problem that transcends the boundaries of public health to acquire the dimension of a major social injustice. The concept that access to healthcare, especially for vulnerable populations like mother and infant, has a major human rights dimension is not new, as shown by this sentence, which was made by Martin Luther King already in 1966. When actually discovered these words, we adopted them as our banner because they really reflect what motivates and make us passionate about our work. If the link between human rights and healthcare, it's actually not a new concept. What is new is the reaction of the world. After several years of progressively increasing interest for maternal and child health, last year the United Nations launched for the first time in history a global strategy for the improvement of women and children's health. It is based on a human rights approach as a call for action for health professionals, politicians, the private sector, and the civil society to work together to improve the health of women and children all over the world. Today we are talking about research. Let's see what we can do from a research perspective to contribute to the UN Global Strategy for Women and Children Health. Well, we can do several things, but let me highlight a few of them that I consider of particular importance. One is to define lines of research that will benefit the health system globally, not only in the richest country. The other one is to coordinate among the different people who are doing research in maternal and child health so that the people who are working in the lab on molecular genetics now will do this with an eye of what could be the implementation of their discovery in 5-10 years from now, even at point of care, even in low resource setting. And finally, we can make research accessible to investigators from all over the world. Many of the collaborative research activities that we are coordinating and facilitating at WHO goes exactly in those direction. And the colleagues who are attending the meeting today will be able to give you more details about those collaborative efforts, with the hope that we will be able to expand them and make them more effective in order to improve the health of women and children all over the world. Thank you very much for your attention and your commitment, and I hope to have the possibility to be with you in person next time. Thank you.